of the University of Calabar and the Foundation for Healthcare Innovation and Development. So I'll be talking to you about chronic care model for non-communicable diseases. And as you're aware, chronic non-communicable diseases are on the increase. So conditions like hypertension, diabetes, chronic respiratory conditions like asthma and the rest. Now the key thing about these conditions, as opposed to conditions that are acute in nature, are that they often do not have symptoms, which means that there has to be a deliberate effort to screen people who are at risk. And the second point is that for these conditions in the long term can result in some complications across most body organ systems. The third point is that part of the package of chronic care would include proper communication and engagement with patients who have these conditions. And so this communication is as important as communication with the patient is as important as the health worker whom they see. The third point is the fact that these patients have to be followed up for a lifetime, and of course there has to be some agreement as to the targets that they need to meet to control their conditions. And so if we draw a corollary with two programs, a tuberculosis control program, HIV control programs and treatment, where you've got patients who are on long-term therapy, we realize that there has to be deliberate effort to screen for these conditions and treat them as well. And so, for instance, if you've got someone who is more than 40 years of age, you've got to have the blood pressure checked, especially if the person is overweight. And if you have someone who is who has diabetes, you would, somebody who is overweight, whose waist circumference for males exceeds 104 centimeters and for females about 50 centimeters, you would also go ahead and screen for diabetes. So a few things really are common in treating these patients with these chronic conditions. And the first one is really the fact that there has to be some screening to diagnose the condition. There has to be some discussion around the chronic complications that these conditions can come up with, and so have the patient understand that the care is long-term. And of course, there has to be some engagement with the patient around some lifestyle changes that have to go, that's in addition to the treatments that they need to receive. And there has to be some record in facilities where they're being seen, in a way, in a bid to continue to follow them up. So essentially, these are the sort of steps that one needs to take when faced with a patient with a chronic conditions such as diabetes and hypertension. And what we're going to be doing next, showing you next, is to have case-based case study role play where we find a health worker and a patient interacting, the patient who has one of these conditions, interacting in a manner that should ensure more or optimal outcome for both the patient really and the health worker. How the trainings run is you've got a group of say 21 and you have them to the role play in threes. So in a class of 21 you have about 7 groups taking turns on the role. So here we've got one of the groups and these are all the participants. So we've got the observer to my right, to my left, and all of them are basically health workers, but they're playing these roles. To my left, the observer, and we've got another health worker as acting as patient, and the other health worker acting as the role of a health worker, so in this case a nurse. And so what you're about to see is exactly how this plays out in this sort of training that we run. So the observer basically does this with the help of the desk guy, just to be able to put things in context.
Okay, so Mrs. Moses, now that we're finished taking care of the problem with your arm, there are other things I would like to discuss with you. So earlier on when you came into the clinic, you remember your blood pressure was checked?
Yes, it was. I remember that.
Okay, and then when you came in again, I repeated the blood pressure.
Yes, I noticed that.
Okay, so on the two times that we did your blood pressure, we noticed that it was a little higher than normal. Okay, we got 145/90, which is a little high.
Yeah, that's high. What does that mean?
Okay, well, usually we want your blood pressure to be less than 140/90. So even if it's high, even though it's high, it's just a little above, what we are expecting from you.
Am I going to die?
Well, I don't want you to be worried. We're going to have a talk. That's why you're here with us. We're going to take care of you properly. So before we start talking, I wanted to ask you a few questions. Okay? Is there anybody in your family that has hypertension? Like by your family, I mean your mother, your father, brother, your sister?
God forbid, nobody.
Okay. What about diabetes? Does anybody have diabetes?
No, it's not in my family. Nothing like that.
Okay. What about kidney disease?
Nothing. We are okay, my family.
Okay. Have you had any children?
Yes, I have 4 children.
Okay, so during pregnancy, have you noticed any high blood? Have you complained about that your blood pressure was high during any pregnancy?
No problem throughout pregnancy. I delivered all of them myself. No problem.
Okay, so also, have you ever been told at any time that your blood pressure was high if you were done somewhere?
And one time when they stole my money after market day, it just went off now. But after that time, it was okay. No.
Okay, have you also checked your blood sugar? Has it been any time that your blood sugar was high?
No sugar. No sugar problem.
Okay, now I would like to ask you a few questions about your lifestyle. Okay, do you take
What is lifestyle?
Okay, that's like the way you live your life normally, just regular things. I'll ask you just a few simple questions. Okay. So do you take alcohol?
Once in a while, maybe at parties, not regular.
Okay, that's okay. And what about smoking? Do you take tobacco in any form? Maybe smoking or taking snuff or chewing tobacco?
No, I don't.
Okay. And what about exercise? Do you do any exercise? Do you live an active lifestyle? Do you partake in any physical activity?
I go to the market every day by 6 and 7. That's hustling up and down. That was exercise to me.
Okay, well, what exactly do you do in the market?
I go and buy my market from the main market, bring it down to where I sell, and I'm hustling, calling market people to come and buy from morning till night.
Okay, so if I understand, you sit down a lot of the time.
Most of the time I'm sitting down.
What about your diet? Do you take lots of what kind of common foods do you eat in your diet?
Oh, I take a lot of apple, gari, pounded yam. I like all those swallows. It will help me to do my business very well.
Okay, so there are some things we need to do for you. Now that we've seen your blood pressure is a little high and some of the risk factors some of the things we've talked about. I'm happy you don't smoke. So now that you've told me you don't smoke, I don't want you to start. Don't take tobacco anymore. Is that okay?
And anything that will make sure that I don't die. I have 4 children. I have to be alive to take care of them.
We're here to take care of you. So what about the alcohol? I know you said you just take little occasionally. I would still like you to reduce your alcohol consumption.
If you to make me alive to take care of my children, I'm ready. Anything you tell me to do, I will go and I will do it.
Okay, I'm happy to hear that. Now, with regards to the exercise, I would like you to start some exercise, some type of exercise. I don't expect you to go to the gym or go register for some exercise, but there are simple things you can do. Okay. Now, while maybe you have to start getting physically active, maybe take a walk, brisk walking for about 30 minutes, maybe after you close from shop. Is that possible?
Sorry, which one is brisk? I don't understand. That English is much for me.
Okay, so you can, I would like you to walk a little bit, more actively. Instead of just taking a stroll, I want you
Okay, I should be
to walk
walking
for 30
fast,
minutes.
like,
Yes.
okay.
So if we do that for 5 days in a week, I think that's okay for us. We can maintain our good
So every
health.
day I should be walking like that fast. For how many minutes?
About 30 minutes is okay.
Even inside the market, I can just walk.
Perfect.
Okay.
Is that something you think
I
you can
can do that one, doctor. I can do that one.
Okay. Now, you told me about your diet. You like to take a lot of heavy carbohydrates like
I need
pounded
that
yam.
energy to do my business so that I will be able to sell market very well.
Okay, well, it's good. I realize that you need some energy, but you can also get energy from other foods. Okay, we need you to lose some weight. You remember I told you that we found out that your blood pressure was a little high and you're a little on the obese side. Your waist circumference that we checked was a little high, so we need to actually cut down on our
So
food.
I'm fat. I mean, that's what you're saying.
Yes,
I'm
a
fat.
little.
So I need to calm down.
Yes, you do need to calm down. So I want you to reduce the amount of carbohydrates that you take. Take more vegetables. Do you like taking vegetables?
I eat vegetable a lot.
What about fruits? Do you like taking fruits?
Doctor, that one is the hard one. Fruits, I don't eat. I feel it's to involve people's food.
No, fruits are very available in the market. They're abundant in the market. So since you're even in the market, it avails you the opportunity. I want you to take lots of fruits. Every day, make sure you take some fruits and vegetables. And then you cut down on the carbohydrates you take. Let's say you want to take some pounded yam. Instead of the large amounts you used to take, maybe cut it into two and then fill up on vegetables. You still be full and healthy enough to do your activities.
So before I can eat 2 wraps of pounded yam, so I should reduce it to 1.
Yes.
Okay. And this fruit, doc, is it any fruit I like? I can just buy. Is there a particular one I should eat?
No, for now I think you can take off fruits.
Okay.
Okay, so is that something you'd be willing to do?
Yeah, I can do it. Doctor, you said all these things to make this BP. I don't want to die. You said to make it come down. Okay.
It will help you.
Okay.
Now coming to your diet, do you like taking a lot of salt?
We eat salt very well in the house. Even sometimes when I buy food in the market, I used to add extra salt.
Okay, so we need to cut down on the salt. Okay, it's not that the food is not going to be tasty, but we need to cut down on the amount of salt. Even when you cook and you feel the salt, the food is not so salty, I wouldn't advise you to add salt to the tea. And this diet, you make sure the rest of the family does the same. It will just make it easier for you. Okay?
Okay, I understand. To reduce salt, I understand.
What about oil? Do you like to take a lot of oil?
No, I like oil food. From where I come from, oil must be on top for the food to be sweet. But I hear say red oil, palm oil is better. So I eat a lot of palm oil. I don't eat too much granola. Is it okay?
No, both palm oil and vegetable oil have their own issues. So I want you to be moderate. It's not that everyone going to use oil, but just use a little at a time. I don't want you to take lots of oil. You're going to have to cut down lots of oily foods. What about meat? Do you take lots of meat and offals?
I'm the expert in that one. We call it orishirishi. I take all those things. That one too is bad.
Well, we are going to have to cut down on them. I would like you to take more fish and chicken, maybe without the skin. That will help you a lot. Now I understand that these things may be difficult.
You read my mind. There are many things you say I should stop this, stop that. How can only me do all these things? I know I want to live, but how will I do all these things?
Yes, I know they can be difficult, but after we start a little, just one step at a time, and after a while you get used to it. The important thing to know is that this is important for your health. There are many complications that can come up when we don't handle our blood pressure. As I didn't explain to you earlier on, blood pressure means the pressure. I don't know when you hear about pressure that your heart uses to pump blood around your body. If it's too high, you can have some complications like stroke, like heart attack.
Yeah, I've had that stroke before. My neighbor, Baba Nkechi, he had it too. I know, I've heard of stroke.
So you see, did you like how you saw
No,
him?
they were carrying him everywhere. I don't want. No, it's not my posture.
I'm
No,
happy. So you're motivated to do what we want you to do.
I will do it too. I don't want to experience that at all.
So we want you to do this for about 3 months. Do you think it's something you can, just start little at a time? The exercise, the diet, the cutting down on the alcohol, doing it for about 3 months, then you come back again and we'll check your blood pressure and we'll see how well you're doing. Is it possible?
What I will try. as I want to be okay for my children. I will try.
I'm happy to hear that. Do you have any question for me today? Is there any other thing that you want
Yes,
to
I want to find out this sickness. My wife, my children, can they get it? Can I give it to somebody?
Okay, well, you can't give it to your husband actually. It's not something that can be transmitted like that. Usually it runs in families. Okay, that's why you heard me asking you whether people in your family have hypertension, like your mother, your father. So that's why some of these lifestyle changes, I want you to start doing it as part of your family lifestyle, so that everybody grows like that, and the risk of having hypertension is reduced there.
So all these things that you have taught, everybody in my house should be eating small salt, small oil. Okay, doctor, thank you very much. This thing you have said, I like it. I like it. I will try. I want to be alive. I will try. Doctor, I promise you I will try. Thank you.
You're welcome. So I'm going to write some of this, I'm going to record some of the things that we have discussed, some of the things that we found from you, so that the next time you come for your appointment, we'll compare it and we'll see how we have done.
So you say my appointment is in 3 months.
Yes, 3 months. We'll give you, the records person will give you a date, a particular date, so that you don't forget it.
Thank you, doctor. I'm very grateful. Thank you. You are my doctor now. Thank you.
No problem. As a team, we're here to take care of you.
Thank you.
Thank you.
I'd like to give some feedback on what just transpired just now. I like the fact that it was a very interactive process. It wasn't just left to the health worker to do the discussion and to lead the discussion alone, but it was also a situation whereby the patient was allowed, she had the opportunity to ask a lot of questions. So it was very interactive. So kudos to you. That was very good. The other thing I would also like to say is that you maintained eye contact. You were not disinterested in an convince, and so that was very good in getting my interest and getting necessary feedback from her. The fact was that you also used guideline to check all the issues that are supposed to have been raised. For instance, you asked about the risk factors. You asked about the family. You asked about whether she smokes, whether she takes alcohol, and whether she exercises, tobacco, and all that. So that was also very good. Then you also took time to explain blood pressure, what blood pressure is. In spite of the fact that she found it difficult to understand but she brought to our own level, so that was also good. Then you spoke about those things that she needs to do to change her lifestyle, the way she looks. And she didn't understand what lifestyle meant, but you were able to explain to her that it's just the normal way she lives her life. And you just didn't stop at the point of telling her to do exercise. She asked questions about whether she can walk in the market, and we were able to explain to her that she gets to that. She also asked questions about the duration of time, and so you answered about that. The other thing you also did was about diets. So you followed the guideline from the beginning to the end, and so that was also useful. You spoke about weight loss and some of those things that you can do to do. The patient herself was very, very active in the process. She asked a number of questions. She asked about alternatives. For instance, alternatives to high carbohydrate diet, to fattening, and told her about seafoods and all the other things. And that was also very, very good. Then it would have been nice to talk about the quantity of alcohol that she took. It's all the fact that you asked about whether she took alcohol or not. She didn't ask about quantity, but necessary to quantify it, to be able to tell her, okay, reduce it from this and offer some other support regarding that. Generally, it was a very good consultation. You can see that she was very happy at the end because she thanked you and then you bonded. And so as a result of that, she's likely to come back for a follow-up. But you don't only stop there. You also told her you're going to record and send a benchmark, like a baseline, and then so that when she comes in afterwards, you can now begin to compare the results that she could get with what's possible. So it was a very good conversation. I'm really impressed, and I think the guideline has helped to to be able to make you very detailed, and so that you're not leaving out all the very important points that you have asked in this conversation. So it was a good